Hi everybody, it's Dr. Newman. I want to talk a little bit about the way my practice is designed, the fact that I have multiple office locations, and how my office functions with those locations. My main office is in Westchester County. It's around the corner from the hospital where I'm Chief of Plastic Surgery, and I have been Chief of Plastic Surgery for 25 years. That hospital, being around the corner, provides a certain level of security and backup for my facility, although it's not something I've ever really needed, but having it close by really gives me a certain luxury and a certain ability here to keep certain things very safe in my practice and have the backup of the hospital being around the corner. The facility in my Westchester office is a Joint Commission accredited surgical facility. It's an office-based facility certified by the Joint Commission, the same organization that certifies the hospital. So this is a unique place. This is a 5,000 square foot office. It has a hospital-grade operating room, full recovery facility here, anesthesia, nursing, and everything here in this office, as well as it being a location where I see patients. My Long Island office in Manhasset on Northern Boulevard and my Manhattan office on Park Avenue and 86th Street in Manhattan, those are both offices where I see patients. I'll be able to see patients there for their initial consultations, for their follow-up consultations, for follow-ups after surgery, but patients will typically come to my Westchester office on the day of surgery. On the day of surgery, everything is done here in the Westchester office, but all of people's follow-ups can be done at the office that's just most convenient for them. It's that way for lots of patients of mine who work in Manhattan or who just find it more convenient because they live closer to these other offices, and then all the surgery is done in Westchester, but the only time they need to come to Westchester is on that day of surgery.